Hi, my name is Paul Knutson. I'm the managing attorney of the Family Law Division here at Denman Perlman, and today we're continuing with the divorce education series. Today we're meeting with Priscilla Singleton, a family and couples counselor who also handles reunification therapy. Priscilla, thanks for joining us today. How are you?
Doing well. Thank you for having me.
Oh, thank you. So, as mentioned, you're a couples and family therapist, correct?
That's right.
Okay, so what's a little bit that goes into that as far as what's your wheelhouse? What kind of people do you work with, and what kind of problems do you help solve for them?
So I work with couples and families around a variety of issues, but primarily specializing with families in transition, and one of the transitions being separating and divorcing families. And in that work, I do some reunification work in addition to co-parent counseling. I also teach at Thomas Jefferson University in a master's program for couple and family therapy, and work at Council for Relationships in Philadelphia, and I'm a therapist there, and supervise interns there, and hold a position called Director of Clinical Standards, where I deal with legal ethical issues that come up with staff.
Okay, very cool. So you actually help kind of form the next generation, if you will, of counselors that are going to be doing exactly what you do.
Yeah, it's my pleasure to do that too. It's exciting work.
That's great. That's great. And part of what you're doing also is reunification therapy, correct?
That's right.
And that's what we mainly want to talk about today. And if you can just give us a little background on what exactly reunification therapy is.
Sure. So reunification therapy is something that's probably relatively new. I'm going to say in my work, I think in the last 10 to 15 years that we've seen more of it specifically called reunification therapy. And this is therapy that really has a primary goal of helping children who may be resisting or hesitating visiting one of their parents after a divorce. This could be children that were freely going back and forth between parents. An event occurs, and now they're resisting one parent. And so that they often will come in to see if we can figure out what's actually happening with the child that's creating that hesitancy. Sometimes it's a court ordered service. So sometimes couples who are going through more of a highly conflicted divorce, they may be court ordered to come to reunification therapy with their child to see if we can't figure out a way to get those visits moving back and forth more smoothly again.
Okay, so it's just fair to say that the earlier that a reunification therapist becomes involved with a child that is hesitant to go visit their parents, the better off the kids will be.
I absolutely agree. I think that a lot of times it's interesting in my work. I've worked with children in reunification therapy when they were younger children, 6, 7, 8 years old, and now I'm seeing them as late adolescents. And sometimes they reflect back on that time when they were resistant and hesitating, and how stressful it was for them, a lot of the guilt that they felt around it. And, my work with them post that work then is to talk about they were children just trying to figure out a pretty confusing, conflicted time. So, in the end, children tend to feel better when they can have a relationship with both parents because of that loyalty to both.
Is that what, most of the studies show is that having both parents actively involved is best for the child? Is that fair?
Yes. Yeah, over and again, I think we're going to see that at the end of the day, having a relationship with both parents is essential in their growing up. And when there's been a breach in that or break in that, there's loss and grief over that, and then to sort of reconcile that again and move back into a relationship. Mhm.
Okay. And do you work with the entire family unit, even though they may be transitioning to being a separate family, if you will, as part of the divorce? Do you try to work with the entire family unit so that the parent that is the custodial parent is also involved as much as the parent that we're trying to help transition back into the life of the minor child?
Yeah, that's a great question. So when reunification therapy began, it was done, I think, in a more punitive way, that there was a lot of blame. If a child was resisting, it must be the influence of the parent that has the child at this point. And so there was a lot of keeping that parent out of the therapy, and only the child and the parent that they were struggling with was in the therapy. And over time, and it's been my clinical experience, is that I really need to build a relationship with both parents first, Because if they're not trusting me as a therapist that they think that understands them and their point of view, they're not going to be able to participate in helping a child move between. So now today, my standard way of operating is I'll meet with both parents. If they're in a lot of conflict, I'll do that separately. I'll spend some time with the mother, I'll spend some time with the father, then I'll spend time with the children. And I tell them I'm not sure who's going to be in what dyad, triad until I have those individual meetings with everyone where they'll be free to speak. If there's siblings, I'll see the siblings together. And then once they get to know me a little bit, I'll also want to hear from them separately so that everybody has their own way to talk to me about how they are experiencing what's happening in the moment. Eventually, it would be wonderful if the whole family could work together, but it sort of depends on the level of conflict between the parents. Yeah, if that makes sense.
If the case was referred to you as part of a court order, what's your first step? Are you meeting with the minor child first, or are you going to meet with the parents
I
separately?
always meet with the parents first.
Okay.
And a lot of times the court orders where I work, I've been working with the court for a lot of years. So it's a loose order that says, meet with Priscilla Singleton and she'll decide who's going to meet with whom. But other times, a newer judge might try to lay out how I'm going to do my work. And so sometimes I'm able to do that. And other times I have to let them know that, clinically that's not going to quite work. And this is how I'd like to work. So I have a good relationship